So the secondary essay was more like details about my disability experience with all those like diagnosis disclosed. If there are chance, of course. Some of the questions were like, what are the challenges you had? And then I explain, okay, so these are my weaknesses, like reading struggles, which was obvious if you look at my MCAT scores. But I also said, oh, because I struggle with reading, I had hard time reading papers in my PhD. And researchers do read a lot to learn about current research, but I couldn't do that. So actually, I started talking to a lot of people, which gave me a lot of like opportunities to work with them. So I got a lot of papers published, and because of my reading struggles, I got more papers than anyone else. And I'm actually finishing my PhD a year early because of that.
Welcome to Life as a Patient Doctor. I'm your host, Dr. Stephanie Moss, navigating life as a patient and a medical doctor. Walk alongside me as I reflect on the challenges and triumphs and lessons I've learned undergoing medical education with invisible disabilities. Join me as I interview other doctors, students, and healthcare workers on their own journeys. Listen to their unique stories on how they balance their health while caring for others in the health profession. Welcome, everyone. Today, I have a very special guest. I am interviewing Mami, who is a PhD student at the University of Michigan, thriving with autism, ADHD, and several other disabilities. Her dissertation focuses on the translation of chemistry into PET imaging, which has motivated her career in medicine. Throughout the medical school application process, she openly disclosed her own disabilities. And this summer, she will start her new career as a first-year medical student. Welcome, Mami.
Thank you. Thank you for having me.
I'm so glad to have you. I would love to hear a little bit about your journey into the medical field.
Yeah, sure. So I'm in the PhD in chemistry. So when I started my PhD, I didn't think about going to med school. So I was his career change. But actually, a lot of my friends don't know this. This wasn't the first time I was interested in medicine. In middle school and high school, like I wanted to become a surgeon, and I'm so nerdy, and I guess I didn't have any friends in school, so I was like always practicing the surgical knots in classrooms. And one of my classmates asked me like what I was doing, so I'm like, oh yeah, I want to be a doctor, so I'm doing like this practicing, and she said, oh, I have an uncle who has a big community hospital in a different state. And would you like to shadow? I went there. It was a great opportunity though. But that was the last time I touched my surgical not practice kit because it was so overwhelming. I didn't know what to expect. And I guess like with autism, I had a lot of struggles in school or like in social setting, and that really overwhelmed me. And I thought, oh, I don't think I can do it because I didn't have confidence in myself. So I decided to pursue like some other career, and chemistry was my favorite at the time. Decided to become a chemist. But then after started my PhD, my second year, I started collaborating with radiology here at Michigan, and I did some pet studies using monkeys. And I'm like, wow, this reminds me of my shadowing time. And I just started thinking about it, like what I wanted to do. And the shadowing experience was like 10 years ago, or more than 10 years ago. Yeah, I feel like so old. But I think I learned a lot more skills to reassess like my ability to do more clinical work. While doing my PhD, I started like doing some volunteering as a medical assistant or volunteering in the emergency department, took some biology classes, and I thought this is something I really want to do. If I don't do it now, I'll regret forever. So yeah, that's my journey. Just starting. I think, yeah, I'm excited.
I love that. How cool that you had that experience all the way since high school. I can imagine like being in high school and watching you do research and so on and be like, wait, how do you know how to do that? I just learned that in my third year of medical school, and you're already doing that in high school. That's amazing.
I just found this like book in the library. Oh, that's cool because I am a very visual person. So all the sketching and like that kind of things attracted me.
Oh, yeah, that totally makes sense. So then what interests you to go like the chemistry and then PhD route? That's interesting.
Yeah, I think chemistry, I'm like very hands-on person and I always loved science. I did study chemistry, math, and physics in community college. And like I loved all those science subjects. But when I decided to pick a specific major in the four-year university, I'm like, yeah, I want to do more like experiments and chemistry seemed the best one because math just sit in and write down some formula and stuff like that, which is fun, but also, yeah, I want to like set up some reaction and cook something in the lab. Yeah.
Oh, yes, that was my favorite part of college. Definitely like the organic chemistry lab. That was so much fun.
Oh, really? You liked it?
Oh, yeah, I loved organic chemistry. I don't know how, but I think I'm the same thing, visual. It helped that I could play around with the molecules and play around with the atoms and be like, okay, that's how that made sense. So I
Yeah.
understand.
Oh, yeah, like organic chemistry, you draw like structures. You don't need to read the long sentence. Sometimes you have to, but yeah.
Yes, no, I totally get it. You mentioned having some different challenges in school. Do you want to talk about some of those challenges that you had that you were able to overcome?
Yeah, I had a lot of challenges in high school. Like one of the challenges was like reading. I'm really bad at reading. I have reading disorders. So I tried to go to college, but I couldn't because I wasn't like my GPA was okay, but standardized tests, like I was so bad at it, even with accommodations. So I actually took 2 years gap before starting my community college. So that was one of them. I would say like communication too, but I didn't really talk to like many people in high school, so it wasn't that obvious. Like I was able to chat, but that's something now I think that I could have done more, but that's because I was really struggling in the social setting.
Yeah, that makes sense. Was there a certain individual or individual that really helped you or was a helpful mentor in your many years of school? Because you've been able to accomplish so much in education, which is huge. Is there any individual or what allowed you to get to where you are?
Yeah, I think so. The big change was in community college. Before that, I wasn't really open to having accommodations because it sounded unfair. And my, parents are Japanese, like the culture in age is pretty much like, oh, you don't like use accommodations, so that's just not fair. Or it's just that disability awareness is not that good, at least like in Japan, I think. So I was hesitant to like, time. And when I studied my community college, I was like that. But this disability specialist I met from school, he was like, no, you gotta do it. And I was already telling him about I want to go to grad school, so to new GRE will be like very challenging. And he's if you don't use accommodations now, you won't be able to get accommodations later because all those testing companies see your accommodations history and decide what you need. So that kind of advice was good. So I started using like extra time or some other resources. And I realized that just like I had the potential to succeed, but it's just I needed a little bit of help. And of course, I did a lot of mentors throughout my, I guess, the many years of education. My current advisor, my PhD advisor, is pretty understanding and accommodating. So even though, like, in the lab, it's very loud there and I get, like, sensory overload. She sometimes let me use her office, just lie down, take a nap, or she got me, like, a quiet office space, so that I can recover my energy. I'm grateful for all those people who helped me get through challenge time.
I love that you had really great mentors that really encouraged you to relook at accommodations. I appreciate that sentiment. Growing up, I didn't get accommodations, and I wish I did. I probably would have been a lot more successful academically, with grades and GPA and MCAT if I had accommodations. But I definitely had that same sentiment of, oh no, I don't want any extra help. It's unfair. And that's not the case at all.
Yeah. You wanna do it with that. You think you can do it? Especially in science classes, I'm like, I love science and I'm good at science. I know that. Like, why would I need extra time for that? But yeah, I think that kind of mindset, I think it's changing. I would say the culture, younger generations are using more accommodation, which is a nice thing, right? But still not many people have what they need or can get what they need, which is unfortunate.
I know you haven't had a lot of direct patient care interaction, but has your own personal experience with disabilities helped you in regard to thinking about their perspective?
Yeah, it's a good question. I'm more empathetic to patients and trying to understand where they're coming from. Like I'm more sensitive to like the cultural or like some other different factors that make people concerned about like whatever the problem they're having because I can really feel I have hard times too, and there are doctors who help me even with the small concern. I want to be like one of them, really listen to people. I think that having disability really helped me be more empathetic, I would say. I'm pretty good at attention to details. So I work in the emergency department and it helps me do my job. Yeah, like the patient care part. I can notice something that I guess a lot of people don't notice. Like one of the examples can be like it was a couple weeks ago. I saw this patient in the hallway bed, and I just offered blanket to the patient, and they're like, "Oh, how did you know I needed a blanket?" I look at each individual in some very small size, maybe rubbing hands like this a little bit or having a jacket over themselves, something like that. And I can see, oh, maybe this patient wants extra blankets.
That is a really great example. And I love how you use your personal strength to see individuals, maybe how they're acting, those little motions, like you said, acting like they're cold. Not everyone would notice those details, but your strengths have given you that ability to be more attuned to those movements. I think that's going to make you a really good doctor of being able to interact with patients in that way. I know that you talked about applying to medical school. And before, I think you said that you actually disclosed your disability. Can you talk about what steps you went through to be able to decide whether or not to disclose? Because I know that's a huge hot topic of should I disclose or not? And can you talk about like, once you made that decision, how'd it go?
Yeah. Okay, so that's a really good question. So when I decided to pursue Korean medicine a couple of years ago, I was like, okay, I don't know if my disability can overcome all the well, I should say, I thought it might be difficult for me to get into med school for a lot of reasons, and one of them is my disabilities. So I listened to a lot of podcasts. I found docs with disabilities. Lisa Makes from University of Michigan creates this like amazing podcast, and your podcast is amazing too. But and I was learning about how to thrive with disabilities, and one of the episodes was disclosure. And actually, in the podcast, though, a lot of students said, "Oh, I didn't disclose," or "It was too risky." Like, it made me sad because disabilities should be looked in a way that's like a strength, right? It is a strength. Like, disability is a strength. So I just wanted to change that. Like, it didn't matter. Maybe like I lowered my chance of getting to med school, but which is fine because someone needs to change this mindset of disclosing my lower chance of getting med school. It won't change. So I wanted to be one who encourage people like it's okay. Everyone has weaknesses. I guess the most important part is like how you address that weaknesses and turn that into like strength. So in my application, I mean, I disclose my disabilities in my primary application, secondary applications, even interviews. But I was very honest about my experience, didn't exaggerate or anything. But also like showed like the positive part of my disabilities. Like I'm actually like did this, and I did because my disabilities helped.
I love that you are an advocate. You saw that other people are struggling to disclose. And so you said, I am willing to take the chance to try to change the culture and show people that they can do it. And I think your episode will be so meaningful to so many people, whether they have disabilities themselves or hopefully even individuals who are reading these applications show that it is a strength. Disabilities is a strength. What other ways did you talk about in your writing or in the interviews that your disabilities is a strength?
So in primary, I just talked about how I guess my disability experience helped me decide my career change because I did my research in radiology, but I was also like thinking maybe I should focus on medical research, not clinical. And having that perspective helped me like, okay, I want to be involved in like clinical work, not just research, because there are a lot of health equity or social determinants of health. And that's something I was really like passionate about. So that I talked about in my primary essay, and the secondary was more like details about my disability experience with all those like diagnosis disclosed. If there is chance, of course. Some of the questions were like, what are the challenges you had? Like some typical med school secondary questions, right? And then I explain, okay, so these are my weaknesses, like reading struggles, which was obvious if you look at my MCAT scores. But I also said, oh, because I struggle with reading, I had hard time reading papers in my PhD, and researchers do read a lot to learn about current research, but I couldn't do that. So actually, I started talking to a lot of people, which gave me a lot of like opportunities to work with them. So I got a lot of papers published. And because of my reading struggles, I got more papers than anyone else. And I'm actually finishing my PhD a year early because of that. So I was able to explain all that. And I think that's one of them.
That is great. Oh, how cool of using, like you said, the challenge of not being able to read as well to be able to communicate with others, learn how to form your own connections and resources. I think that is something that people don't talk a lot about in medical school, but is actually one of the most common things is going to these conferences and speaking with people, forming those connections. And that's how you get papers published, research published. That's how you get speaking invitations. It is definitely not something that a lot of medical students, you're not taught. You're not taught how to form those connections. So that is a really good strength. And I'm glad you brought that up.
Yeah. I know, like, I met a lot of people with disabilities, and they always see the disabilities as negative, and they don't even realize something they did, like something like amazing that they did, actually related to their disabilities. So I think finding the connection between the disabilities and a big accomplishment might be key in that kind of application. Yeah.
That is a really good thought. I like that. Yeah, that's a good point of seeing that connection of how does it intersect? What are your strengths? What are your weaknesses? I love that. I know you talked about it a little bit of just the importance of breaking stereotypes and promoting diversity in medical education. Do you want to talk about a little bit more of the benefits of having individuals with disabilities in the medical field?
Yeah. Having benefits, like no one would disagree, like not like diverse. I think disability is one of the like the parameter of diversity, and it's definitely a skill set. It's how others see the world, and learning that perspectives is important. So like whether you're medical class or even the patient, different kinds of doctors working that humanize them, I think. I don't like to see, like, even if my doctor is so smart, but if my doctors are all like, white cis men or something, it's just, I don't know. I don't know if they really understand my struggles. Humanizing medical professionals really like help patients trust the medical system, I think. Yeah.
I love that you said that humanizes patients. I think that is one of my goals through this podcast is to really humanize health professionals and doctors to realize they're not just one aspect. They're not just the brain, the science, the medicine. There's
Yeah, that's
more.
good. Yeah, intimidating, right? Or this guy is so smart, lots of titles, and do they really care about my very small concern or that? Yeah. Of course, like all those doctors, amazing, and they care about patients. I know some of my friends with disabilities, they actually prefer to see doctors with disabilities because they can really connect and easy to disclose like all the struggles that they have.
Yes, talk more about that because I think a lot of times we're missing the patient perspective. We talk about that we hope that patients will want to speak with people with disabilities. But yeah, have you had that experience of speaking with other health providers or your other friends? How have
Yeah,
you, yeah, found that being
I
able to disclose more or talk with other providers?
personally didn't have any physicians who disclosed their well, I guess there's someone like who informed me of like their experience as a patient too, and that helped me like, oh, I'm more comfortable talking about my own experience, my struggles, or my concerns because I just feel, I don't know. I think patients need courage to something discuss some of the problems, and sharing their own perspective really helped me do that. I know like some other friends said regular doctors without disabilities don't get it. And sometimes I had that experience too when I'm like very overwhelmed in a doctor's office. I just want all the lights off because it's very overstimulating. But sometimes having that sort of like experience, they don't immediately get it. And so when I get overwhelmed, I cannot use my like vocal words to express like, okay, I want lights off. And I'm shut down and the doctor will be like, oh, what's going on? Are you okay? Do you want to go to the ER or something like that? But no, like it's not like I just want the lights off and maybe do the physical exam, but maybe not touch my face or something because that makes me so uncomfortable, or just give me some space. And I think having that experience as a patient will help like doctors see the same like symptoms in their patients, I think.
I'm really glad that you shared those experiences with being overstimulated and having difficulty using words to even say, I'm being overstimulated and this is what I need. Because I think sometimes people just assume that we can, that people can just say their challenges and say what they need. And that's really hard to do, especially when you're overstimulated or triggered, no matter your disability. I think about it a lot with people who have trauma. When you're in that mode of so much emotion, it's really hard to use your words and actually say, I need this. Because sometimes your mind just goes blank. So I
Mhm.
liked that you stated that example, and hopefully that also helps some other health practitioners or even family members or anyone individuals who are overstimulated, give them some extra grace. They just need some time. Maybe provide different options of what's helped in the past.
Yeah.
As we finish off, looking ahead, now that you've been through so much education and life experiences, do you have any pearls of wisdom to pass on to other health professionals, students, especially people who have disabilities? Do you have any advice to share with them from your journey?
Wisdom. I already have wisdom, but something that I would say to myself maybe a couple months ago, just believe in yourself. I was very scared when I was applying, like disclosing the low MCAS score, not taking the typical prerequisites because I didn't have a lot of bio credits. So I'm like, oh, maybe I'm not getting any interviews. I had to find a job. Um, but I got interviews, like more than one, and I got into med school. It's not same way because I think before the April deadline, it's not official. But I'm going to school like my top choice, and I'm very excited. And I just couldn't see that when I was in that like the moment of figuring out. Also, a lot of people discourage us to disclose the disabilities in applications. So I thought maybe I should have done that, but it worked out. And I think with disabilities, like you do experience a lot of challenges. And those challenges might be like very obvious. It might discourage you from going to med school or going to whatever the career you want to do. But it's gonna work out. If you really wanna do it, it's gonna work out. So just believe in yourself.
Believe in yourself. That is such great advice. And thank you, Mammy. I'm going to go through all the amazing things you talked about today. So, you started off by saying that the first time you thought about medicine, you were in middle school and high school, and you were interested in being a surgeon. You found a book on how to do surgical knots and were there practicing doing surgical knots, got connected with being able to shadow some physicians. When you went through more of your education, you found that maybe chemistry would be more your skill set and your passion. So you went into chemistry, even got your PhD, you're almost at getting your PhD in chemistry. And then you had the opportunity to do some research with radiology and using that experience to help you realize, oh, this might be what I want to do the rest of my life, being more into the clinical aspect of medicine and using that shift of noticing all the needs in the medical field and using your own experience as an individual with disabilities. Use your strengths that you've been able to really develop and hone in. Use that as part of the reason why you want to be a doctor, to be able to connect with patients, be empathetic, really understand the cultural aspects of medicine. You've also talked about how your disability has allowed you to be very detail oriented, is directly useful in medicine because you can see the body language, you can see the whole picture, not just what the patient is verbally saying, but noticing other aspects that maybe other people aren't as attuned to. Using that and so many other things as your strength, deciding to switch past, go back into getting those biology classes. Even when you struggled with the MCAT, you didn't let that push you down. You didn't let that stop your goal of being a doctor. You kept going. You even took a step forward by being an advocate and saying, no, the disability is part of my story, part of who I am. I'm going to disclose in my primary, secondary application, and also the interviews and talk about it. And it worked out. People didn't just shut you down. Like it was successful. And now you're going to be going to medical school. You're going to be a first year medical student. Also, you'll be a medical student with a PhD and be an MD, PhD. Not a lot of people get to say that. You've worked really hard, and I can't wait to continue seeing your journey.
Oh, thank you.
You're welcome. I just want to thank you, Mimi, so much for joining in. I also want to thank everyone who's listening in. If you liked this episode, please share it with one other person. It's so important to use your community because that's how we can really share the awareness that doctors are human and people with disabilities can be in medicine and can contribute positively to the medical community. So please share it with at least one other person that you think might benefit from these stories. Also, I like to say if you're struggling, remember you are not alone in your experience. I remember that during a lot of these challenges in my life, it's very easy to feel like you're alone. And just remember, you're not. There are other communities, there are other people out there that are struggling. So do not give up. Lastly, you can get in contact with me on my social media at medsmoss. And then you can also see my website, which has resources for individuals with disabilities, both patients and if you're a health professional. That way you can learn how to support other individuals. Maybe if people want to get in contact, is there any way that you would like them to get in contact with you?
Yeah, you can email me at MAMIH at ich.edu. So that's Mami and age at umich.edu. That's my email.
Wonderful. Thank you so much for sharing that. I'll make sure to include that below. And I'll also include that Docs with Disability podcast episode that you mentioned regarding disclosure. I also was present during one of those interview presentation. And you know what? That was also what motivated me to start disclosing in my residency application. So that is a really good episode. So I'm with you. I remember people saying that they struggled and they didn't disclose. And I was like, what type of advocate am I if I'm not disclosing? So I was like, you know what?
Exactly. Yeah,
I'm
yeah.
going to do it. So I'll make sure
That's
to link
good.
that episode down below. Thank you, everyone, so much. Make sure you subscribe to anywhere you listen to your podcast. I hope to see you for the next episode. Thank you again, Mammy, for coming on the podcast. Bye bye.
Bye.